Now we're going to take a look at the different types of vertebrae. Recall that there are cervical, 7 of those, thoracic, 12 of those. There are 5 lumbar vertebrae. There's 1 sacrum composed of 5 fused sacral vertebrae, and there's 1 coccyx composed of 3 to 5 fused coccygeal vertebrae. We want to learn to differentiate between the different types, and actually you'll find that it's quite easy to do. Okay, so this is a typical cervical vertebra, typical thoracic vertebra, typical lumbar vertebra. These are also cervical vertebrae, but they're not typical. This specifically is C1, called the atlas. This is C2, called the axis. This is the sacrum, and this is the coccyx. So let's look at each type and see how to differentiate between the different types. So here's the typical cervical vertebra, and the 2 features that you'll notice unique to the cervical vertebrae are, first of all, a bifurcated or forked spinous process, and secondly, there are holes called transverse foramen in the transverse processes. These transverse foramen are the passageways for the vertebral arteries and veins. Now, please ignore this hole. This hole is a byproduct of the fact that this vertebra came from a model. C1 and C2 are unique. This is C1, called the atlas, and you'll notice that it does not have a body. However, it does have the transverse foramen and the transverse processes. C1 has superior articulating surfaces which articulate with the occipital condyles of the occipital bone, forming the atlanto-occipital joint, and that is the joint that allows your head to move as if you were saying yes. There's also an area right here on the atlas called the fovea dentis, and the fovea dentis articulates with the dens of the axis. Now this is the dens of the axis. The axis is C2. So let's look at it and then we'll try to put the 2 together. So this is C2, the axis. Again, you have transverse foramen and the transverse processes, so it's clearly cervical. The superior articulating surfaces of the axis articulate with the inferior articulating surfaces of the atlas, like this, but also notice that the dens of the axis articulates with the fovea dentis of the atlas. Now remember that the articulation between the superior articulating surfaces of the atlas and the occipital condyles of the occipital bone form the atlanto-occipital joint and allow your head to move in the direction yes. Well, the articulation between the fovea dentis of the atlas and the dens of the axis form the atlanto-axial joint and allow your head to move as in saying no by rotating like this. So that's C1 and C2. Again, unique. This is a typical thoracic vertebra. Notice the long, slender spinous process. It's not bifurcated. Additionally, on the thoracic vertebrae, you have, and they're not always very easy to see, but you have articular surfaces for the ribs. 12 thoracic vertebrae, 12 ribs. On the transverse process, there's an articular surface that articulates with the tubercle of the rib. And on the body of the transverse vertebrae, there's either 1 or 2 articular surfaces for the head of the rib. Now specifically, thoracic vertebrae number 1 through number 9 have articular surfaces on their bodies called demifacets, and that's because with thoracic vertebrae 1 through 9, a rib articulates sort of between the vertebrae, and we'll try to have a look at that on the skeleton in just a moment. While with thoracic vertebrae 10, 11, and 12, a rib articulates with 1 vertebra, and so you have a whole facet or simply a facet. Nevertheless, the thoracic vertebrae have the long, slender spinous process. It's not bifurcated. And on the transverse process and the body, you will see articular surfaces for the ribs. Again, the head of the rib articulates with the body of the vertebra. The tubercle of the rib articulates with the transverse process of the vertebra. This is a typical lumbar vertebra. Look how much bigger it is, and look at the square nature of the spinous process. The body is bigger. Just compare the vertebral bodies of these three. So lumbar, thoracic, cervical, very obvious size difference. You can see here the spinous process of the lumbar vertebra, square-shaped, versus the spinous process of the thoracic, long and slender. And once again, the bifurcated nature of the spinous process of the cervical vertebra. Okay, this is the sacrum, the 5 fused sacral vertebrae. This is the coccyx, made of the 3 to 5 fused coccygeal vertebrae. We're going to go to the skeleton now and see how the ribs articulate with the thoracic vertebra.